Good afternoon. I would like for you all to take a walk with me. We're going to explore our health care and our health. When a parent presents to me with a child with dental problems, I really have at least two patients. I have the child who needs my direct care, and I have a caregiver and possibly a family unit whose child care is responsible, for example, for what you see in that upper left-hand corner. This is an image of the mouth of a 13-month-old child. Mom first came to me when the child was 18 months of age. She had been to a provider who said, to take care of this, we have to do one of two things. Either take out those top four front teeth, or we can repair the teeth. And given that the child is 18 months of age, you can't expect this child to be cooperative. This condition that you're looking at is called early childhood caries. All caries doesn't look like this. This is a rather extreme form of it. So at 18 months, the mom came to me, and quite frankly, she was in hysterics because she thought I was going to offer her the same two options. So after I got Mom literally to stop crying in front of me, calm down, we talked about the child's health, overall health, and we talked about the child care. I had to find out exactly what was going on, a series of questions, and the questions had to give me answers that I could understand. Then Mom and I had to work out some solutions which were good for her and me, and now you see this child at 30 months of age. Now you see the cavities, yeah, it's there. But this child's infection has been controlled. It has been stopped. I want to tell you why. If you look at the gingiva, pink, tight, no film. You can see the light reflecting off of it. You can see the white bands of normal enamel between the brown areas, the cavities, and the gingiva. Teeth continue to erupt. And if the infection wasn't stopped, those areas would be totally brown like the cavitated areas. And you guys know that Explorer thing, the thing with the pointed end on it? I can take that Explorer and I can push down on those brown areas. They are not soft. They are as hard as ground glass. This child eats carrots, celery, meats. She's healthy. She's happy. Mom has changed her child care, and now she is competent and confident in her ability to take care of her child. If we had not stopped this infection, other teeth in the back, which would have come in, which are there now, which would have been infected, and just as important, this is a progressive infection. As the adult teeth come in, they would have gotten this infection. In the year 2003, the American Academy of Pediatrics and the Centers for Disease Control recognized that tooth decay in children is the most prevalent, common, contagious illness of children. Not allergies, not asthma. Okay. So we have been successful at managing this child, and I'm sorry, Mom did not take the treatment options for the dentist because she couldn't afford them. She couldn't afford the care under general anesthesia, and she did not want the dentist to take the teeth out, and she told me, I don't want you to take the teeth out. So it's very important that Mom took care of her child care. It doesn't matter if you're an individual, a couple, a group, business, sports, doesn't matter. If you're going to be successful at anything, you have to do two things. The first thing you have to do is, what is the goal? What is the value that we're trying to attain? If it's more than one person, we have to discuss the values so that value becomes shared, the same, and that we both clearly can understand and define it. The second thing we have to do is that once we decide on what's the goal, we've got to decide who does what. You're going to do this, you're going to do that. We clearly understand those roles. Both are grounded. We clearly accept them, and we know we're going to do them. That's what we have to have. I'd like to talk about our healthcare system. The major players of our healthcare system are consumers, providers, physicians, dentists, nurses, social workers, and payors. Got some questions for you. First question. If you think our healthcare system is in good shape, doing a good job, please raise your hand. If you think our healthcare system is doing an okay job, it's doing okay. We got some issues, but it's okay. Raise your hand. Good. If you think our healthcare system is not doing a good job, and it's really having problems, raise your hand. Those of you who raised your hand that it was doing a fair job, you know what's going on in D.C.? Our federal government is shut down because nobody can agree in the healthcare system that what should happen. And this is a symptom of the sick patient. Our healthcare system is sick. With any illness, there are symptoms, and this is the one that's knocking us down. And the problem is, these three groups all look at the healthcare system quite differently. Those of you who are in this audience, you probably have good access to healthcare. You're probably not who I'm talking about. But there are lots of people in this country who they can't exist in this system. I have two more questions for you. Don't have to raise your hand. First question. I want you to rate your oral health. Think about it. Do you think your oral health is good? Yeah, I'm in good shape. Everything's fine. Do you think your oral health is fair? Yeah, I may have a couple of problems. Or do you think your oral health is poor? Don't raise your hand. Second question. I want you to rate your oral health awareness. What you know about oral health, what you know about what's going on in your mouth. Could you talk to me and tell me what tooth decay is, how it happens? Could you tell me when is it the best time to brush your teeth and gums and why? Could you tell me whether or not diet soda is harmful for you? Could you tell me if mouthwashes really help you or not? Everything about us is about a balance between two poles. The G, genetics, and the NG, all that stuff, lifestyle choices, habits, medications, so on and so forth. In the year 2000, the Surgeon General, David Satcher, produced the first oral health report of the nation. He said four things. Number one, poor oral health, tooth decay, bleeding gums, gingivitis, bone loss around your teeth, and chronic oral malodor, not talking about the garlic that you had last night's dinner. These are by far the most common chronic illnesses across the lifespan. Number two, we clearly know, good studies show that these entities significantly impact our overall health, our wellness, self-confidence, productivity in the marketplace, and success in school. The most common reason for missed school days for children, tooth decay. Okay. At conception, sperm and egg comes together, we develop the gamete, grow in the womb, that's all G. Even during that time, there's some NG that's coming in and threatening your growth. Hopefully at birth, you've attained all you can be, and now you're ready to get moving, but that's when the NG becomes really huge, as per my case example. This is a parent who didn't understand what was it about her child care that was harming her child. She didn't mean anything, just didn't know. So, this statement should be pretty clear to everybody, that this is very connected to that. In fact, I have some proposals for you. This is my mantra. Very simple. Teeth are like trees and gums don't lie. What that means is, I can ask you a bunch of questions. All I need to know is your age and your gender. If I know those two things, I can ask you some questions, and based upon your answers, if you're telling me the truth, I know exactly what your mouth is going to look like before I look at it. And if I look at your mouth, I'm going to know if you've been stretching me out a bit. Okay? What this means is that if I'm going to do dental care for you, okay, if you've got good NG, okay, you take good care of yourself, your mouth is presenting me pretty good, my care is going to last longer. On the other hand, if you present to me and I can see you're not taking good care of yourself, and I look at your NG, how you're behaving, what you're doing, I know my care is not going to last well. The payors are beginning to understand this. Think about what's going on in the healthcare system. Any dentist can tell you, family dentist can tell you, I have two groups of patients. The first group of folks, they come in when they're supposed to. I ask them questions, their answers are good. I can see their health histories, they're pretty good. They look pretty good. I have another group of patients, they don't come in when they should. Their answers to my questions are not great. You know, yeah, they don't look so hot. And when I look at their health histories, I see a bunch of things going on. There were two other things that David Satcher said that I forgot to mention. Number three, the NG for your mouth and the NG for the rest of you are the same. If you look at the common chronic illnesses, obesity, diabetes, cardiovascular, respiratory issues, high blood pressure, your physician, you guys are all pretty much too young, but your physician is going to be talking to you about your NG. And that's what's tough. It's not, even if you've got some bad NG, it's your even if you have some bad genetics, it's your NG, it's your lifestyle choices, habits, whatever, which are going to push you over the edge. And lastly, the thing that we're understanding now is that in your mouth, all these issues we're talking about are infections. Your mouth is loaded with lots of different flora, and most of the time they're cool. They don't cause any problem, unless your NG allows these things to do, to create bad stuff. Then your body wants to fight the infection, so it sends in all these special cells, inflammation, to wipe out these infections. Unfortunately, what happens is that while these special cells, your inflammation to protect you, is whacking the bad tissue, it's whacking the good tissue. And then these cells and the products of inflammation are also going to the rest of your body through your circulation. We clearly know now that diabetics who have good oral health have their diabetes is much better to manage, and they're saving their payors income. So, given what we've talked about, it's really what you're doing and what you're showing, that it would seem to me that a way we could get our healthcare system to do better is that we have to get involved. Right now, we're recipients. This is my health model. Very simple. I'm a pediatric dentist. What I see is the child, I can see the mom or the dad or grandma, and I'm seeing the same issues because the child is getting the same care that the adults live under in their self-care. So what I'm trying to do is to change lifestyles. I'm a lifestyle coach. So what we have here is a very simple system in which we need to understand that families are health units. We clearly know there are great studies that show that children who have their first little visit in their first year, as recognized by the CDC AAP, they have a very different kind of health journey than children who don't. And all the commercial dental insurances will tell you that folks who come in for timely visits, preventive care, they have a very different kind of journey than those who don't. And of course, we're talking about awareness at the beginning. The mom of the child in that picture, she had no idea what she was doing right or wrong. She was just loving her child. So we now have the technology to bring personalized information to anyone of any age, anywhere, at any time. Consider the benefits of this information. As a dentist, I know exactly how, when, why, who's going to be in trouble. I could interview each one of you, and based upon the answers to my questions, I know exactly where you are in your journey in health. And this leads to that. So, what are the benefits? We're talking about health, keeping people healthy, autonomy and confidence. And then we're talking about care management. In our healthcare system, we know the big cost is coming from taking care of people who have a number of different illnesses. We admit that they're sick, but what we want to do is to manage their care to keep the healthcare costs down. We talk about transparency in our healthcare system. How can you have transparency in a healthcare system which is not getting the easiest data to get? A dental visit is probably the most effective, efficient, and inexpensive way to get meaningful data about where you're going. The big ticket items don't come until you're an adult. Most of you in this audience are pretty young. 10, 20 years from now, you'll be showing up some of those big ticket items depending on what you're doing. Number two, one of the problems we have in healthcare is the lack of access to dental care, which doesn't make any sense given what I've just said. So what I want to do is to increase access to dental care so that you know how you're doing and the payers know how you're doing so we can address these cost issues. Number three, we have now this thing called the health exchange, and that's information going across providers so that we can care manage better. How can you have a health exchange without oral health as a foundation? And then lastly, the problem with our healthcare system is there's no transparency. Each of the units are doing their own thing. They're looking at their own values. So if we have a transparent data set that brings everybody to the same value, that means you're accountable, the payors are accountable, and the providers are accountable. So, this is my mantra to you, this is my statement. How can we have health without people understanding what's going on here? Last question. I'm going to give you a choice. Would you rather not brush your teeth and gums for a month or not bathe for a month? Think about it. I'm spearheading the creation of a password-protected, consumer-centered, transparent healthcare interface that tracks oral health information from consumers and caregivers and dental visit examination outcomes, data as its core. It's my goal to bring consumers autonomy and confidence, and healthcare a method to promote global health guidance via oral health information. This program would also allow you, it would be yours, it's your coach, because over age, risks to oral health predictably change based upon information that you're not even thinking about. I have enjoyed our walk together. I hope you have too, and thank you and be well.